The word typhoid had always sounded strange to young Rahim when he first heard it whispered around his village. Over centuries, the illness traveled in silence from crowded ancient cities to the busy trading lanes of South Asia, becoming one of the most stubborn fevers known to humankind. But for Rahim, its history was just another line in his schoolbook, until the day it entered his home and changed everything. Rahim lived in a small town near a river that fed the fields his father worked on. Poverty shadowed most families in the area, and life was a daily struggle between earning enough money and keeping everyone healthy. People drank from communal hand pumps that rusted with time, children played near open drains. And most families believed that fevers came from bad wind, evil eye, or season change. It was in such a place that typhoid found easy ground, quietly seeping in through contaminated water and unhygienic food. One hot summer, Rahim's younger sister Aiza returned from school, unusually tired. She complained of headaches and stomach pain, and as the days passed, her fever climbed higher, refusing to settle even with home remedies. Neighbors offered all sorts of advice-burning herbs, praying special verses, keeping her wrapped in blankets to sweat out the fever, but Aiza only grew weaker. Their mother believed it was the result of exhaustion, or perhaps the evil eye. As Aiza's fever worsened, Rahim remembered his science teacher mentioning something about typhoid symptoms: persistent fever, weakness, abdominal pain, loss of appetite, and sometimes rashes called rose spots. He looked carefully at Aiza one evening and saw faint pink marks on her abdomen. A chill ran through him. The stories that once felt distant now stood right in his home. At first, they hesitated. Going to the clinic meant losing a day's wages, waiting for hours, facing rude staff, and maybe buying costly medicines. Politics had shaped healthcare in their region. Promises made every election were quickly forgotten. Hospitals remained understaffed, equipment outdated, and medicines in short supply. Yet Rahim insisted, and they finally agreed. After a few questions and a simple lab test, he confirmed it was typhoid fever caused by Salmonella typhi, a bacteria usually transmitted through contaminated water or food. The doctor explained how poor sanitation, lack of clean drinking water, and weak public health systems helped the disease spread. The medicine was not expensive, but for Rahim's family, it was still a burden. As days passed, Aiza slowly improved, but not without struggle. Some antibiotics no longer worked due to rising resistance across the world. The doctor warned them that resistant strains were becoming common, making treatment harder and more expensive. He told them about new, stronger medicines and how modern research was trying to outpace the bacteria that kept evolving. He also mentioned WHO's efforts to spread awareness, distribute vaccines, and guide governments in fighting typhoid globally. NGOs visited villages, teaching families about boiling water, washing hands, and avoiding uncovered street foods. The world was fighting typhoid, but the battle was uneven. One afternoon, an NGO health worker named Sana visited the village as part of a vaccination drive. She explained the importance of the typhoid vaccine, how it offered protection for years, and why every child should receive it. Many people refused at first, held back by false beliefs that vaccines caused infertility, weakness, or even death. Religion mixed with cultural myths, creating confusion. A few elders insisted that only prayers and traditional methods cured illnesses, while some believed modern medicine was a foreign plot. Sana tried her best, but convincing them was an uphill task. Sana smiled at his curiosity and explained everything with patience. He turned to his parents and said that if the vaccine could prevent another scare like Aiza's, they should trust it. Seeing their son so confident, they hesitantly agreed. Aiza received her vaccine once she recovered, and soon more families followed. Slowly, the resistance softened, and the village realized that prevention was far easier than suffering. Aiza went back to school, smiling again under the shade of the neem trees. But the experience had changed Rahim forever. He began reading more about diseases, curious about how they spread and how they could be stopped. He learned about how governments could reduce typhoid by improving water supply, building proper sewage systems, and running hygiene education programs. He read about how WHO supported countries during outbreaks, provided technical guidance, and pushed for global immunization. He also learned how NGOs played a major role in remote areas where governments struggled to reach. One evening, as monsoon clouds gathered above the fields, Rahim sat outside with his father. They talked about how their town could improve. His father said that if local politics focused more on health than on speeches, fewer families would suffer. Rahim nodded, realizing that health, economy, and society were deeply connected. A healthy community could work better, study better, and build a stronger future. Stopping diseases was not only a medical duty, it was a social responsibility. Inspired, Rahim started a small awareness group with his friends. They visited homes, explained how typhoid spread, encouraged people to boil water, and taught children proper hand washing. They worked with teachers, got support from the local clinic, and even convinced the town's imam to speak about hygiene in Friday sermons. Slowly, their efforts started showing results. Fewer children fell sick. More people vaccinated their kids. Open drains were cleaned. Roadside vendors covered their food. Even the local government noticed their effort and provided water filters to schools. The regional impact grew more visible each passing year. Where typhoid once visited every home with ease, it now struggled to find hosts. Families who once depended only on myths now trusted science. The environment improved as people stopped throwing waste near water sources. Women discussed health openly during community gatherings. Men who once ignored medical advice began taking preventive steps. Everything changed because awareness spread like light through the cracks of ignorance. But life threw another challenge. A severe typhoid outbreak hit a nearby district, fueled by contaminated water after heavy floods. Hospitals overflowed, and fear gripped the area. Rahim and his group traveled there with assistance from an NGO. They delivered bottled water, distributed chlorine tablets, and educated families. They helped health workers identify patients and encouraged vaccination. Watching so many suffer reminded Rahim of his sister and the helpless feeling he had once experienced. But now he was stronger, informed, and determined. One day, while helping at a relief camp, a man approached Rahim and thanked him. His daughter had been very sick, and because of Rahim's advice earlier, they brought her for treatment quickly. She recovered, and the man believed Rahim had saved her life. Rahim felt his eyes sting with emotion. He had never thought an illness that once frightened him could one day become the reason he found purpose. Years later, Rahim received a scholarship to study public health. His dream was to return as a doctor or health officer and bring long-term solutions to his region. On the day he left for the city, his sister hugged him tightly and whispered, "Because of you, I'm alive and healthy today. Go and help others like you helped me." As the train moved forward, Rahim gazed out of the window, watching his village fade into the distance. He remembered how typhoid had once been a shadow over his family, born from ancient history and strengthened by poverty, lack of education, and societal myths. But he also remembered how modern medicine, global support, government efforts, and community awareness had turned the tide. He realized that diseases were not just biological challenges, they were shaped by politics, economy, society, and environment. And they could be defeated, not by fear, but by knowledge, unity, and hope. In the years that followed, Rahim became a respected specialist working with WHO programs, designing strategies for typhoid prevention, clean water access, and vaccination campaigns. He visited villages across many countries, sharing the same lessons he had once learned as a worried brother. He watched hesitant mothers become confident protectors of their children's health. He saw families transform their lives with simple hygiene practices. He saw governments adopt stronger health policies. And he witnessed modern advances: better vaccines, more effective medicines, faster diagnostic tools that made typhoid less deadly than before. One day, he returned to his village as part of an international project. The place looked different now. Clean water taps stood where polluted drains once flowed. Schools taught health education as part of the curriculum. Vaccination cards were kept proudly by parents. Food stalls were covered and hygienic. The village that once feared typhoid now stood as an example of prevention and progress. At the community center, surrounded by smiling faces, Rahim spoke about the journey they had all taken together. He reminded them that typhoid was once a disease that thrived on hardship, ignorance, and poor conditions. But through awareness, cooperation, and perseverance, they had weakened its grip. He encouraged them to maintain hygiene, trust science, support vaccination, and demand strong healthcare policies from their leaders. When he finished, Aiza stepped forward with a shy smile and said, "My brother once saved me from typhoid. Now he helps the whole world fight it. If one child can grow up to change so much, imagine what all of us can do." Applause filled the hall. The sun dipped behind the fields, painting the sky with shades of hope. Rahim looked around and felt a warmth that no fever could ever bring. Typhoid, once an enemy, had become the reason a community united, the reason a boy found his purpose, and the reason thousands now live safer, healthier lives. And so, the story of typhoid, a disease born from ancient times, became, in this small corner of the world, a story of transformation, resilience, and endless hope.